Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Hyderabad, Masters in Orthopedic. There are many methods of treating the knee pain according to the diagnosis, according to the age, and according to the cause effect on the joint. When we see the infective nature, that means it's because of the bacterial, then antibiotic therapy. It's because of the viral, then we need to manage symptomatically with the antiviral treatment. If there is a specifically tuberculosis, then anti-tuberculous treatment with the drainage of the joint, and then when there is a fungal infection also, sometimes we have to rule out and then treat according to the antifungal treatment. Apart from this, when there is a infection in the joint with a abscess, then we should drain the abscess, let out the pus in the joint. This is the one way of treating the cases with infective nature. And apart from this, what we see is there is a degenerative changes in the joint. When there is a degenerative, because of the wear and tear in the joint leads to the degenerative changes, leads to the erosion of the cartilage. So such a particular things, it all depends on stages of the degeneration, stage 1, 2, 3, 4. According to the stage 1, 2, we see that it is called as a synovitis. In that nature, we must treat with physiotherapy and splinting the joint, supporting the joint, and then certain medication which controls or avoid the further degeneration. Then when there is a stage 3 and 4, then we should think of doing intra-articular injections, or there is a disease or the modifying surgery, like weight loading part will be shifted to another way by doing the osteotomy of the bone, and then certain in stage 4 we have to do a total knee replacement, changing the entire joint with the artificial joint. So this is the way the cases can be managed in the degenerative arthritis. When there is a tumorous condition, like you do a benign tumor or a malignant tumor, according to that we have to manage surgically. When it is a benign tumor, then we can curatize the benign tumor, put the lot of artificial bone graft or a bone from the patient himself and fill the gap. When there is a malignant or a cancerous tumor, that should be treated according to the chemotherapy, radiotherapy and surgical. Surgical means enhanced excision of the tumor. So these are the tumorous conditions where in the knee pain we should treat. So the next option is ACL injury is the most common injury. That's the ligament which controls the movement of the anterior aspect or the forward aspect. So when that ACL is injured, then it should be treated arthroscopically, doing the or transforming the tendon from the same leg into the ACL and reconstruct it with the screw as well as the ligament. So this is the one way treating the ACL. And then when there is a collateral ligament injury, treat arthroscopically. When there is a meniscal injury, you can do arthroscopically repair of the meniscus. So these are the various treatable causes can be cured very well in the knee joint.